Okay? Great. So I moved from there. I did the wrist already. But you also want to work the fingers. Make sure that they're moving. And I just take each finger and move them back and forth a few times. You can curl them and open them. Curl and open. If someone has problems where perhaps their thumb is tucked in here and they've got a little bit of spasticity holding them down there, then you can bring them out into a gentle stretch and hold it a little bit longer if you need to. Okay? So now I'm incorporating the fingers and the thumb. And we'll go about 10 repetitions there. Okay, how did that feel?
Okay. Yesterday, those fingers wouldn't have worked.
Okay. So what you'll see is a fluctuation possibly day to day, depending on the information that your patient or resident will share with you. They may be having an off day. It's important, though, to realize that if there is a decrease, for instance, if I come in here tomorrow and her shoulder barely moves, I certainly need to notify the nursing staff of that or the appropriate people that are in charge at that time, just to let them know there's a significant decrease in function. And that's important that you note that. Thank you. From the upper extremity here, we're going to move into the lower extremity. And as I said before, you want to make sure that if they have hip problems at all, you have to be very careful with the range of motions that you do. Typically, the easier ones to do are the flexion and extension, which I'll show you in a moment, and the abduction and adduction. Important things to remember if they do have hip problems is not to take the leg past midline too far, as that could cause some problems. So if I took this leg and moved it and crossed it over the other ones, and she had hip problems over here, that could cause some problems. And I also don't want to, okay, bend your knee for me a little bit. I also have to be very careful if she has a hip fracture, that this motion here where I rotate the hip in and out will cause a lot of pain, and I could actually pop the new hip joint out. But as I checked out beforehand, our resident here does not have hip problems, so I will show you the full range of motion. I just wanted you to be aware of some of the things that you may run into. One thing I'm trying to do is lay her as flat as possible here so you have as much motion in the hip joint. If we had the head of the bed up, what would happen is the hips would be bent and her upper body would be here, and she would have contractures, and she would be in this position. And when it came time to start walking, she would be bent over. So you want to get them in as full extension as possible. All right, to start with the hips, what I like to do is I like to cup under the heel, and then I grab just behind the knee and I slide my leg up a little bit onto the thigh. And we start by just bending the knee gently until you feel a little bit of a stretch. Is that okay there? Mm-hmm. And then we'll go all the way down. It's important that we go all the way back down here, or we're not doing the full range of motion. And up and down. And notice if I was to the end of the bed, I wouldn't be able to get full extension as well. So positioning again is key. Now when you're working with lower extremities, really watch your back, as legs can get heavy. Now let me do this for you. As I'm taking over all of the work here, the leg gets a little bit heavier. Okay, and you'll do 5 to 10 repetitions there as well. That's flexion and extension. Now we'll do abduction and adduction. Abduction is away from the center of the body. So I'll take the leg out, and when I see that there's a little pull here, or if this leg starts to slide, then I know I'm far enough. And back in. And I'm being very careful not to drag the heel across the bed. This helps prevent bed sores as well. There's 3. And 4. And 5. Good. And that's abduction and adduction. You're adding it to the midline of the body. Okay? So we did the knee and we did a little bit of the hip. We'll do hip internal and external rotation. There are 2 ways of doing this. One is just to grab the leg and rotate it out and in. And out and in. This works better for people that don't have a lot of knee range of motion and they can't flex the knee. Okay? Internal, external. Another way of doing that, if they have knee motion, to move up to this position, we can do the internal and external rotations here. Okay? I'm getting a nice stretch right there. This way, people typically have a little more motion in this direction. Moving down from the hip and knee, we'll move into the ankle. And for the ankle and foot, I like to cup my hand under the heel and stretch up and back and up and back. And I'm using my forearm to stretch a little bit. You feel that stretch behind your calf here? Is it too much?
No.
Okay. And back down. We're just working that motion back and forth. Important to work the ankles. This is very important for balance. And now I'll rotate the foot in and out. And keeping motion in the foot also enables people to have better proprioception and balance when they're walking too. Okay? And then we also work the toes. You mind if I take your sock off?
No.
And then we work the toes. The big toe is very critical. If you don't have good motion in that toe, your balance will be off as well. She's got pretty good motion here with all of them. Important pointers to remember: get your resident or patient in a good position to start with. Get yourself in a good position to start with. Remember your body mechanics. Take the range of motion to a gentle stretch. It's okay to be somewhat aggressive, but you don't want to be, you also want to have some caution with it as well. Get feedback from your resident/patient if possible. If they aren't able to communicate, you could check to see if the body is moving in certain ways as you're stretching them and get feedback that way as well. If you come across any adverse findings that don't make sense to you, that maybe some decrease in range of motion, certainly report those findings as well. And that concludes the range of motion portion of the videotape.